All good. Thank you for coming along today. I've been joined by Professor Sutton to update the Victorian community on the next big step of how we live safely with COVID in our community, with responsibilities increasingly being devolved to industry, workplace and community settings. I just point out that Monique, our Auslan interpreter, has to go in 45 minutes, so I think that's a good target for us all. And we've got to this position today because Victoria is one of the most vaccinated places in the world. We now have more than 2/3 of our community who are eligible triple dosed. And in some cases, particularly our most vulnerable older Victorians, those figures are up to 80 and 90% plus for triple doses. We've seen whether it's people in their 50s, their 60s and 70s come through in really solid numbers, and they continue to do so. The Omicron wave is starting to subside, and based on that, we're seeing that reflected in our steadying of case numbers, particularly the lowering of the 7-day average. That's why we're in the position of being able to take some important steps over the coming days. So from 11:59 p.m. on Friday, the following changes to the pandemic orders will be made. People won't be required to have 2 doses or show their vaccination status before entering venues. The requirement for staff and patrons of venues to check in using the service's Vic app will end, and operators will not be required to maintain attendance records or maintain a check-in marshal. Masks will no longer be required in primary schools, in early childhood settings, or retail settings, or at events of any size that applied in the greater than 30,000 and a few other locations. Close contacts will no longer have to quarantine, provided that they wear a mask indoors and avoid sensitive settings, and they will also need to carry out 5 rapid antigen tests over the course of the 7 days that they previously would have been in isolation. Further, all visitor restrictions in hospitals will be removed except for mask requirements, with health services able to tailor their own settings based on their own circumstances. And we've been discussing this matter with health services for some time, and we know that they will variously apply continued sensible restrictions that apply to their particular workforces, patients and locations. Events with more than 30,000 people will no longer require public health pre-approval. International travellers who are symptom-free will be recommended but not required to undertake PCR or rapid tests on arrival, and unvaccinated travellers will no longer complete 7 days quarantine. Pre-departure tests for unvaccinated air crews will also be lifted. People will be exempt from testing or quarantining for 12 weeks if they've previously had COVID-19, up from the current 8 weeks. Individuals will be required to notify their workplace contacts in addition to informing their social contacts. Workplaces won't have to notify individuals and each potentially exposed worker in an outbreak, but they'll have their general occupational health and safety responsibility for advice to their workplaces. These are sensible measures, and they can be taken based on our very high vaccination rates. We know that there will be a long plateauing and tail to this BA2 Omicron subvariant wave, but what we know is that we've passed the peak, and that we are able to look to this group of sensible measures being able to take us into a still challenging winter. Only the most important of settings remain, like staying home if you have COVID, and visitor restrictions in vulnerable settings such as aged care, disability, and some hospitals will of course apply those measures in their locations. All workplaces will be required to have COVID-safe plans, but just like they manage other occupational health and safety risks in their workplaces, it will be up to those workplaces to manage those plans. And of course, the existing vaccination mandates will still apply for those workers who currently need either double or triple vaccination requirements for their particular workplace based on the particular risk profile of their sectors. It's sensible that we keep some of these most basic measures and settings in place so we are able to balance changes to the settings that we're making with the huge and continued pressures that our health services and healthcare workforce continue to face. It's more important than ever that we all do our bit to ease the burden on our health system by staying up to date with our vaccination status. So that's the way you avoid getting sick, that's the way you avoid ending up in hospital, and that's the way you can contribute to our health system getting through what will still most likely be a challenging winter. On a different matter, this is also probably the start of a flu season, and we encourage everybody through the normal primary healthcare mechanisms, the normal workplace mechanisms, to go out and get your flu vaccination jab. To do that ahead of winter is very important because we are expecting, after 2 seasons of pretty much zero influenza, we are expecting significant outbreaks of the flu over the course of this coming winter. I'll be getting my shot later today, and I'd encourage everybody to make sure that they contact their primary healthcare provider to go out and get that flu jab as well, as we'd expect a bit of a comeback for flu over the course of the 2022 winter. We need to take all of these sensible steps to both live safely and alongside of COVID, whilst we continue to manage a return to safe, normal life, whilst protecting our healthcare system and helping out our healthcare workforce. That's how we're going to get through this winter together. That's how we've got through the last 2 years and a bit together. And I'd encourage everybody to do their bit. I'll hand over to Brett to give us a bit more detail on those changes, and then we're happy to take questions. Thank you very much.
Thanks, Minister, and good morning. So today is a significant day for all Victorians, not a wholesale change, but an appropriate next step in this phase of the management of the pandemic. So from Saturday, it will absolutely focus more on the individual discretion of all of us in the community to make appropriate choices for ourselves, to protect ourselves and protect those around us as we go about our day-to-day lives. The phase that we're in now is only possible because of the very high vaccination coverage that we've achieved. Really astonishing protection for our population and the many millions who've been vaccinated right through this pandemic, but in particular the third doses that have been given through the course of this year at GPs, pharmacists and state-run centres and all our community pop-ups. Just fantastic work to give us that protection that allows us to be here making these changes today. So I do want to thank every Victorian, every health worker, every person in our entire health system and everyone who's stepped forward to get a test or a vaccine. That collective effort has safeguarded our community and saved literally thousands of Victorian lives. We're now at a point where 19 out of 20, essentially on 95%, being double vaccinated. We've got 2/3 who are triple vaccinated. Indeed, amongst those who are eligible, because some have recently had COVID, it's above 70%. And we've reached that milestone in just 5 months. And the vaccine rates among older Victorians are even higher. Got 90% coverage for those over 70, 85% for those over 65, 82% for those over 60, really terrific figures. And it means we're in the best position to make a further easing of restrictions. It is significant, but it's a sensible one. It will allow us to get back to a better normal, help keep us safe at home, at school and at work, while we can still respond to the emerging risks. For the remaining restrictions, we're focusing on areas of highest risk, including to protect those who are most at risk in aged care, the disability care settings, and in other sensitive settings where mask wearing will continue to be required. The third dose vaccine mandates for our critical workers still remains in place, so healthcare, disability and residential aged care, police and emergency services, food distribution and in education. As a community, we also need to remember those basic and simple behaviours that are part of our everyday life and that will continue to work for this variant, for any future variant. Opening windows, good ventilation in our workplaces, homes and other settings will continue to be a protection. Wearing a mask indoors continues to be a protection, and staying up to date with your vaccine. Many countries have lived with restrictions for a long period of time. Some are still imposing significant restrictions. We had our restrictions to get to a point where we knew that we would be very substantially vaccinated as our really significant protection as a community. We're at that point. Here in Victoria, with these vaccination levels, we've got enough inbuilt protection as a community that further restrictions are really not proportionate or necessary. Of course, there's more to do. We've still got 30% of people who, if they're not immediately due for their third dose, will be very soon or are recovering from COVID and should think about getting that third dose. For those who haven't had their third dose and are due, really now is the time to do it. There are 4 reasons to do so. Our cooler months are coming. We're going to have challenges in the healthcare system through winter, as we do every winter. The flu season will be one, but there are other direct effects of colds that mean people present with cardiovascular and respiratory conditions. And there'll be lots of other respiratory conditions circulating. So a good time to be protected from COVID. Your second dose protection is good protection against severe illness and hospitalisation, but it does wane over time. So if it's been a few months, now is that time to get the third dose to reboost your immune system for protection against COVID-19. Thirdly, there are still a lot of people with significant vulnerability to severe illness with COVID, those over 50, those with pre-existing conditions, those with weaker immune systems. If you're in those categories, you really should think about that third dose now. And lastly, while cases are plateauing now and we're very likely past the peak, we do still have broad community transmission, 10,000 cases per day. So it isn't behind us. We still need that additional protection as much as possible. So don't just rely on 2 doses through winter. Make April or May the time to get your third dose. And as you know, there's a 4th dose recommendation for over 65s and some other at-risk groups that ATAGI has recommended. My mum's one of those. So as an 81-year-old, she got her COVID vaccine and her flu vaccine yesterday in the one appointment. So good on you, mum. Please think about that if you're in those categories and get that dual protection through winter. Thanks very much.
Well, thanks, Brett. Happy to take questions.
How long do you think this can last? Are you prepared to put restrictions back on in winter as Brett just outlined that things could put pressure on the health system?
Well, as we've outlined, very high rates of vaccinations give us the bedrock of certainty that allows us to take these measures today. We know that high levels of vaccination that Victorians have worked so hard to achieve give us the ability to take these significant steps today. Of course, we'll continue to monitor the situation, but we're pretty confident that continued high rates of vaccination have got us this far and will get us safely through the winter. But as Brett said, there's still more that needs to be done in people coming forward to get those other vaccinations. We just think now it's proportionate and sensible to return as much as possibly we can to business as usual, and that applies to people getting their vaccinations.
14 people died in the latest update. Is that acceptable? Are you comfortable with that?
I want to see all Victorians vaccinated to the highest possible levels that they possibly can be, because what that means is that is protection against severe illness and hospitalisation. It is protection against getting into intensive care units, and it's the best protection you can get to protect your own life whilst at the same time protecting our health system. Every death is a tragedy during the COVID-19 pandemic. We've seen millions of deaths around the world. That is why we've had to take the extraordinary measures of the past 2 and a bit years, but we now are in a different phase. Based on these world-leading levels of vaccination, we can take these safe, proportionate steps, return life as much as possible to normal, and put the responsibility and the shared responsibility of protecting each other and protecting our health system back to the normal processes of industry, workplace and community level measures.
Can you foresee, just quickly, can you foresee a time in the next few months that low-level restrictions are reintroduced if cases climb?
What I can see is that as we've, particularly through this variant, seen case numbers subside, built on high levels of vaccination, that gives us the certainty to take these measures. What's around the corner, we'll continue to monitor that, and like always, factor in the public health advice, but all the advice, as Brett's just touched on, is that now is a safe, proportionate time to take these pretty significant steps to return safely to living with COVID and responsibility for living with COVID as much as possible to the industry, workplace and community level.
I just want to ask about our daily numbers. We saw them dip down to 8,000, they're back up to 10, we know numbers go up and down. Where do we plateau and when do you think that will happen?
I think the plateau's here. I think it's probably already behind us. We have seen a 10% reduction last week on the previous week. I think today's a blip. I think people defer some of their RAT tests and their PCR tests while they're on holiday. New South Wales has had the same blip today, but I think that'll smooth out over the next few days. And I think we'll see, this plateau phase, but it'll be a long tail and a slow decline. We're not going to see a dramatic drop in numbers. Again, just a reminder that if you haven't had your third dose or your fourth dose, if you're due and eligible, you really should get it now as well as your flu dose. There's not a lot of influenza circulating right now, but it's not far away.
Can I still just clarify some mask rules? So for hospitality, is that customers and staff?
Not required.
And for public transport, does that include Ubers, rideshare and services?
It does. It does.
Why masks required at airports but not at places like Chatston? We've also got lots of people going lots of different places and getting them together.
I mean, the requirement for airlines was a national decision, and AHPPC gave advice to National Cabinet on that, and so that's a nationwide requirement. When you're in the air, there's pretty good circulation through the ventilation on planes, but when you're actually on the tarmac, those CO2 levels go very high, above 2,000, which is a lot of rebreathing other people's air. 10 or more percent. That's a genuine risk, and if mandates are dropped on planes, I'm going to be wearing a mask when we're idling on the tarmac. So I think that's a good idea.
Just with following, I guess, about public transport, it's still mandatory. Are you happy with the amount of people actually wearing masks on public transport, because it's not particularly high?
Look, I guess not. I'd like to see more people wearing masks on public transport. It's not fantastically high. It is a place where ventilation is a bit trickier, buses and trains in particular. If you can open a window. That's more an option on trams, I guess. But you're in a crowded space and there's a lot of rebreathing other people's air, and so it is a good idea to wear a mask on public transport in particular.
Have you been doing any confirmed stats on the rate of people actually using them on public transport?
Look, we get regular survey data. There is, it's self-reported data. People are probably more willing to answer those surveys if they're doing the right thing rather than the wrong thing, and it's reasonably high. But you'll see circumstances, as Richard no doubt has, where there's a particular setting where mask wearing is not great. We tend to follow what we see around us, so you can be a model for other people in wearing your mask as well. But I think it's reasonable, but you know, it's not over yet, that's for sure. And so mask wearing remains a really important intervention. And I continue to wear mine in places that are particularly at risk, absolutely where it's mandated, but also in lots of other indoor settings where we're gathering. But we can make choices about that now.
Just on the decision to scrap isolation for close contacts, is it the case that now that we have these vaccination levels, less people are contracting the virus? Do you know how many in families? Is it like 1 in 10 chance, or do we know those figures when it comes to close contacts?
Look, it's still substantial for household close contacts. So it's not scrapping of quarantine per se. I think we need to talk about it as alternative close contact management, because it is. These individuals are still required to wear a mask. They're still required to work from home if they can. They need to avoid sensitive settings. We recommend that they don't have close contact with at-risk individuals, and they need to do RAT tests almost every day. So they're all other mitigations that help to manage that risk. But they are at significant risk of developing illness over that 7-day period, and that's why all of those measures, including the RAT tests on consecutive days, will give a much higher chance of picking you up if you're developing illness. You may well test negative, test positive, but when you're testing positive on a RAT test, that's when you're most likely to be infectious. And so it's a imperfect but a pretty good way to manage those contacts alternatively.
Have we done any modelling into how this will affect case numbers, the change in the close contact?
We have. Modelling is modelling, so we don't hang our hats on it in absolute terms, but it looks to be reasonably equivalent. So it's not going to be a big driver of case numbers to go up. It's going to be able to manage those individuals, but we need the compliance of people to follow suit, and we need all of those conditions of alternative contact management to be in place.
Where is the most significant point of transmission for you at the moment then, with the statistics you're looking at?
I mean, really, it's all of those marginal things where people have minimal symptoms they need to test. So, you know, it's not just in the cases that we identify in their close contacts, it's the people who have no symptoms or very minimal symptoms who are going to transmit to others. That's why mask wearing remains a really important measure for people to think about in indoor spaces, because you won't see a symptomatic individual, but there'll be 1 or 2 potentially infectious individuals in a shared indoor space. So getting tested, wearing a mask, those indoor opportunities for transmission are really the key ones.
Is vaccination required for office spaces under the rules?
No, it's not. Again, there'll be specific workplaces where it does remain a 3-dose or a 2-dose mandate. But not for general office spaces that don't fall into those critical or high-risk industries.
And the mask rules apply to primary school children as well?
No, they don't.
Oh, so that's still being reviewed for term 2, or?
So that's not a mandate for primary school kids ongoing. Masks remain recommended.
Your most recently published advice to the Minister said that mandates for vaccines in some workplaces could actually go. Has the Minister gone against your advice by keeping it this time?
No, I mean, the Minister can speak to it, but I've made a recommendation of a transition out of those mandates, but they need to be worked through industry by industry. They need to do their own risk assessments, and they need to fall on their own policy settings appropriately based on those risk assessments. Some of them will no doubt lift those mandates and allow their workforces to attend work without a vaccination requirement, but some of them may well land on a policy that has an ongoing mandate, but that should be worked out industry by industry.
But for the time being, we're keeping the mandate.
Well, the Minister can speak to the transition point that we're going through. I've talked about a recommendation for them to transition out of that when feasible, but that has to be worked through.
When would that be feasible? Is there a kind of time frame on that?
So I'm glad you read the Chief Health Officer's advice, and my response, no doubt, would have answered your questions, which is also published. And those response is exactly what Brett said. There continue to be a number of high-risk settings, health, aged care, disability in particular, where based on all of the risks that come together, we think it's both proportionate and safe to continue to wear masks in those locations. And of course, we will always continue to review these things, but based on the fact that we are now subsiding in case numbers and that we, as Brett said, look like we're coming down a long, slow plateau, the worst of the BA2 subvariant would appear to be behind us. That's why we're able to take these significant steps today, whilst at the same time making sure that we protect vulnerable settings and high-risk locations such as aged care, disability and our healthcare system.
What's your message to health workers who are fearing another run of the hospitals? You know, they're going to be exposed and people are getting reinfected. What's your message to them who are going to be worried about these restrictions?
Yeah, so my first message is one of thanks to the hundreds of thousands of healthcare workers, from the chief executives to the security guards and cleaners, but particularly the clinical frontline workers. They've done an extraordinary job, and that's why we're in this position we're in, because of their hard work. The challenges that they were facing before the pandemic have been amplified hugely during the pandemic. And what my message to them is that these set of arrangements about the proportionate measures of taking sensible, freeing up measures, whilst at the same time having in place measures that protect our healthcare system. Our healthcare system continues to be under significant stress. What we're asking it to do is to still manage several hundred a day high-risk COVID patients. What we're also asking them to do is to deal with increasing normal activity, which is at record levels, and we're also asking them to look at the backlog of deferred care. Put all of that together, that's an enormous ask. That's why we've invested in February $1.4 billion in the continued ordinary operations of our ambulance and healthcare services. That's why just a few weeks ago we announced a $1.5 billion investment in our elective surgery strategies, particularly partnering with the private sector and indeed taking over a private hospital to drive elective surgery rates. And put all that together, these are long-term structural changes that place a sustainable healthcare system at the heart of what this government is on about. We, all Victorians, thank those healthcare workers. We can express that thanks by backing in these programs that build step by step the recovery of our health system. That's what this government is doing, and all Victorians can get on board that train by getting their vaccinations, keeping them up to date and following the minimal restrictions that are now in place to keep our hospitals operating safely.
Will there be any work to ensure that people can actually access a rapid antigen test, or people might not be able to afford them so easily?
Of course, our state centres continue to distribute free rapid antigen tests. Just rock up. All sorts of industries have strategies in place. Part of what we're doing is devolving that responsibility and decision making to industries and workplaces. It should be part of the normal occupational health and safety management of running a COVID-safe workplace, that protocols around testing are in place. The proportionality of those will vary from workplace to workplace. We encourage all workplaces to take their responsibilities seriously. There is an obligation to have a COVID-safe plan. That isn't changing. How that is applied is up to each workplace, and of course a key part of that is testing, and the state will continue to do its part in having accessible state centres for PCR testing, but we'll also do our bit in the wider distribution through multicultural communities, through at-risk communities, through public housing and other high-risk and elderly Victorian settings, those ability to take rapid antigen tests at a community-based level.
Is that just for close contacts that you'll be recommending employers?
Could you say that again?
Will that just be for close contacts that you want employers to be providing?
Well, it'll vary. The risk profile will change from industry to industry, and these responsibilities have to be worked out at an industry level. We've heard from employers, from peak industry groups, from trade unions, from community groups, from all sorts of sectors that they're ready for that step. We have the assistance. That's why we have a work cover agency. That's why we have public health and local public health units in place to provide that guidance. But the responsibility, as if we're going to live safely with COVID, is to devolve the level of decision making to that industry, workplace and community level.
Will the government be doing that for the public service and also for schools then? Will RATs be available for those that are close contacts to be
particularly for education settings, the Minister for Education announced that certainly for the first part of term 2 that we'll continue to distribute rapid antigen tests through the education system. He made that announcement before the break for the school holidays, and we'll continue to provide in appropriate settings rapid antigen tests for our frontline and other workforces, and at each level of the Victorian public sector, we'll engage with our employees and their representatives as what's the best way to both manage ongoing the COVID risks and to test for them.
Unvaccinated travellers arriving into Australia no longer need to quarantine. So what happens to Mickleham?
Well, Mickleham, for some time now, I think it's had over 800 people go through it, and I'm not sure of the exact figure, but I think there's still several hundred people out there. They've overwhelmingly been Victorians who can't safely isolate at home who have COVID. That opportunity is still there and will continue on. People in big families, people at insecure housing, of the many thousands of Victorians who need to isolate because they've got COVID every day, it's been an invaluable resource. But it's more than just a COVID quarantine and isolation centre. It's a national resilience centre that is available to the Commonwealth for all sorts of other emergencies, everything from international refugees to people who are facing natural catastrophes.
The latest figures I received was just above 100, not several hundred people at Mickleham at the moment. Do you think in the future it should be repurposed at all?
Well, no, I don't think that's the case. It's a national resilience centre that has a wide variety of needs. It would have been extraordinarily handy to have 2 years ago. And if we've learnt anything from the global pandemic, it's that you can't rely, sadly, on the Commonwealth Government when the need is there. The states have stepped up. We now have a National Resilience Centre, and we're going to have a few of them as a result of the leadership that the states have brought. These are an investment in Australia's capability to deal with this pandemic, hopefully with the worst of it well and truly behind us, but for future pandemics. But they're also centres for a whole range of other things, natural catastrophes, international refugee supports, and a range of other services. Any other questions?
One more for the Chief Health Officer.
Sure.
One for Foley. You've left that
Too late.
You mentioned it's now up to the individual discretion of people to protect themselves, protect their families. I guess what is your advice to people that are immunocompromised, the elderly, going into this next phase of the pandemic?
I mean, we all need to make appropriate judgments depending on the setting that we're in and the people we're in contact with. Obviously, the TGA has approved and ATAGI have recommended a vaccine regimen for those who are most at risk. For immunocompromised people, many of those will fall into a category where a fourth dose is a routine recommendation for those individuals. I hope they're all accessing it, they've all received it. I think that'll be a really big part of protecting them from serious illness. But if you're meeting with someone who might fall into that category, you should also think about where you meet, how you meet, and whether you wear a mask in an indoor setting. I think that's always been the case. It should continue to be the case that we're mindful of particularly at-risk individuals. If there's an opportunity to meet outdoors, that's a really important decision to make. That'll reduce that risk of transmission 20-fold or more. So do that if you can. But otherwise, our responsibility is about getting vaccinated for ourselves, because it's not just protection from severe illness. It's some protection from getting infected in the first place. You know, we need to talk about the limitations of vaccines as well as the strengths that they've provided for us. A lot of people say, you know, we've got 10,000 cases a day, vaccines aren't working. They are working. We've got a 0.09 case fatality rate as a percentage compared to 4% in 2020. It is extraordinary how much protection there is given the case numbers that we're seeing every day. But it is not a perfect vaccine for protecting us from getting infected in the first place. It's excellent protection from getting hospitalised. That'll apply to those most at risk as well.
And sorry, just one more. In terms of businesses and advice to business, is it up to them now to come up with a policy for close contacts coming into work? Should it only be in, you know, necessary industries, or is that something that you'll be providing advice on, or is it up to them?
Look, their occupational health and safety obligations have never gone away. The OC Health and Safety Act applies. We've looked after a lot of those OC Health and Safety issues through the mandates that have been in place over the last couple of years, but they should remember that those obligations continue to exist for workplaces and for employers. So they need to do what is reasonable to manage the health and safety of their workforce and, to the extent feasible, the general community. So the conditions for close contacts will apply to all close contacts, but it is absolutely the case, as you say, for workplaces to think about anything else that they would do on top of that, including the communications and support to people to be able to manage alternative arrangements for working.
After a couple of years of us sort of having to change the rules and adjust to this, what's your gut on, does this stick? Is this us on the way out?
I think it's more steady as she goes now than it's ever been. But none of us should be complacent about what future challenges might arise. There's no question that the XEs and the BA4s and the BA5s, you know, continue to emerge. They will drive cases up to a degree. They are less likely to challenge our hospital system as we get more and more people vaccinated. But we shouldn't drop our guard on all of those protections. I do think we're entering a more stable period, but we shouldn't sit on our hands in this space and say there's no chance of a future significant wave. That remains a possibility.
Oh, if I have to ask another question about the Royal Children's Hospital.
About
the Royal Children's Hospital and the philosophy to train doctors in emergency medicine.
Yeah, I note the position of both the Royal Children's Hospital and the standards that it has in place. And I note the position of the Australian College of Emergency Medicine. I'll leave these clinical standard debates to clinicians, but what I will say is that Royal Children's Hospital is not just Australia's leading paediatric hospital, it is the world's leading paediatric hospital. It has the highest clinical standards. It is a national, indeed an international leading centre for cancers, for brain tumours, for a range of areas. It acts as the leading facility in the nation and in this part of the world. I'm confident the relevant college, the Australian Emergency Medicine Group and the Royal Children's will work out this professional issue between professionals.
How can it be fixed? Is there anything that the government's able to do to step in?
I know that the clinical standards for training for paediatricians in the Royal Children's Hospital is world class, and I know that the Australian College of Emergency Medicine and the Royal Children's Hospital are in close conversation, and I continue to be confident that the standards of training in the children's are the world's best, the nation's best, and I'm confident that those two professional bodies will resolve this in a professional manner.
There are now just 4 hospitals in Victoria that are accredited to train doctors in paediatric emergency medicine. Is that good enough, in your opinion?
Well, the Royal Children's Hospital's still accredited in terms of the training that it's undertaking right now, and I'm more than confident that this arrangement will continue once the college and the children's work out their professional issues between clinical professionals. All good? Thanks. Thanks, Monique. Thanks, everyone.